Have you ever heard of borderline personality disorder, or BPD? It's one of the most talked about, but also one of the most misunderstood mental health conditions out there. Today, we're breaking it down step by step. What it is, what the symptoms look like, where it comes from, how it's treated, why it often gets misdiagnosed, and how you can support someone living with it. Let's dive in. What is BPD? Borderline personality disorder is a condition that affects the way someone feels about themselves, how they manage their emotions, and how they connect with others. It's like living on an emotional roller coaster. Small things that might not bother most people can feel overwhelming, and relationships can feel unstable, almost like walking on a tightrope. But here's something important to know. BPD isn't about being broken or difficult. It's about having emotions that are turned up really, really high and struggling to regulate them. So what does BPD actually look like in daily life? Here are some of the key signs. A deep fear of abandonment. Someone with BPD might worry constantly that people will leave them, even over small situations. Intense relationships that can swing from idealizing someone to suddenly feeling hurt or angry with them. Rapid mood changes, from joy to sadness to anger, sometimes within hours. Impulsive behaviors, like reckless spending, risky driving, or binge eating. Feeling empty inside, like there's a hole that's hard to fill. Difficulty controlling anger, sometimes lashing out, sometimes bottling it up. And during times of stress, even experiencing paranoia or dissociation, like feeling disconnected from reality. Now, it's worth mentioning, not everyone with BPD has every single symptom. It shows up differently for different people. So where does BPD come from? The truth is, there's no single cause. Experts believe it's usually a mix of biology, certain parts of the brain that handle emotions and impulse control might work differently. Genetics, if a family member has BPD, the chances of developing it are higher. And life experiences, especially things like childhood trauma, neglect, or unstable relationships. But here's the key point. Having difficult experiences doesn't guarantee someone will develop BPD. And having BPD doesn't mean someone is doomed to a lifetime of suffering. It's complex, but it is manageable. Now let's talk about something hopeful. Treatment. For a long time, people believed BPD couldn't be treated. That's simply not true. The most effective therapy is called dialectical behavior therapy, or DBT. It teaches skills like emotional regulation, mindfulness, and healthier ways to cope with stress. Other approaches, like cognitive behavioral therapy, can also help with unhelpful thought patterns. Medication isn't a cure for BPD, but it can be useful for managing symptoms like depression or anxiety that often come along with it. With the right treatment, many people see huge improvements. And yes, people with BPD can absolutely build stable, fulfilling lives. Here's something a lot of people don't realize. BPD is often misdiagnosed. It's sometimes mistaken for bipolar disorder, depression, or PTSD because some of the symptoms overlap. This is why it's so important to get a proper assessment from a qualified professional, not just rely on internet checklists. Misdiagnosis can delay the right treatment, and that's frustrating for people who just want answers. Maybe you're watching this because someone you care about has BPD. So, how do you support them? First, be patient. Emotions can be intense, but they're very real for the person experiencing them. Validate their feelings. Even if you don't fully understand, letting them know you hear them goes a long way. Encourage therapy and treatment, but avoid pressuring them. Set healthy boundaries. Supporting someone doesn't mean sacrificing your own well-being. And finally, educate yourself. The more you learn about BPD, the better you can understand what your loved one is going through. Having just one supportive person can make a massive difference. So, to wrap it up, borderline personality disorder is a mental health condition that brings intense emotions, unstable relationships, and real challenges. But it's also a condition that's treatable, and people can and do recover and thrive. By understanding BPD better, we can reduce the stigma, support those living with it, and create a more compassionate space for mental health conversations. If you found this helpful, share it. You never know who might need to hear it.